Hello. The histology of the male reproductive system. The male reproductive system consists of your testes, you have a pair, and they are extra-abdominal in location. They are encased in your scrotum. Behind your testes, you have your epididymis, which is dorsally located, and it drains into your vas deferens. Your vas deferens becomes intra-abdominal to go behind the bladder and is joined by your seminal vesicle. This will drain into your ejaculatory duct and join the prostate and go to the urethra. In the urethra, there's also your bulbourethral gland or Cowper's gland that will contribute to the seminal fluid along with your paraurethral glands in your penile urethra. The testis is encapsulated by a thick fibrous tissue, your tunica albuginea, and inside the testis you have several testicular lobes. In these lobes you have your seminiferous tubules. The seminiferous tubules will drain into the mediastinal testis, and in your mediastinal testis you have your retitestis, and your retitestis now will drain into your efferent ducts, and the afferent ducts will now store the spermatozoa temporarily in your epididymis. Your epididymis has your head, body, and tail, and the tail is the beginning of your vas deferens. During ejaculation, the epididymis will contract and expel to ejaculate through the vas deferens. Here is now a cut section of your seminiferous tubules, and here you have your myoid layer. At the base, you have your spermatogonium. The spermatogonium, you have two types, type A and type B. Type A may undergo mitosis and give rise to type A and type B spermatogonium. Okay? The type B may undergo now meiosis to form your primary spermatocytes. The primary spermatocytes will contain a duplicated genetic material, and this duplicated genetic material now may undergo meiotic division further to become your secondary spermatocyte, later on becoming spermatids, and the spermatids now further differentiating into spermatozoa. In the interstitium of your testes, you have now your Leydig cells, and the Leydig cells will produce testosterone. In the seminiferous tubules, the spermatid further develop to become your spermatozoa through the process of spermiogenesis. You have your spermatid, the Golgi apparatus polarizes to the north, while your centrioles will polarize to the south. The Golgi apparatus will form your acrosomal head, while the centrioles will develop your flagellum. The excess cytoplasmic material will slough off until you have now your mature spermatozoa. Around the midpiece of your spermatozoa, you have your mitochondria that will provide energy to the motility of your sperm cell. In the seminiferous tubules, in the germinal epithelium, you have intervening Sertoli cells. Here, the Sertoli cell is perpendicularly oriented with respect to the basal lamina. The Sertoli cell is important in supporting the growing germinal epithelium. It provides your blood-testis barrier anatomically, physiologically, and immunologically. It has endocrine properties and is influenced by the follicle-stimulating hormone that is produced from the anterior pituitary. The Sertoli cells will produce your ABP or androgen-binding protein, and that will stimulate your Leydig cells in producing your testosterone. It also produces your inhibin to give a negative feedback to your anterior pituitary. The anterior pituitary produces follicle-stimulating hormone and luteinizing hormone. The follicle-stimulating hormone will stimulate the Sertoli cell to produce your androgen-binding protein or your activin. This will activate the Leydig cells to release the testosterone. The luteinizing hormone produced from your anterior pituitary will influence testosterone production of the Leydig cells. Testosterone will also give a negative feedback to the pituitary from producing further luteinizing hormone, while the Sertoli cell will produce inhibin to give a negative feedback to your anterior pituitary from further FSH production. From the seminiferous tubules, you have now your immature sperm cells that will pass through your straight ducts, and this will drain into your retitestes. Your retitestes are lined by locuboidal cells. From the retitestes, it will drain now into your efferent ducts. The efferent ducts are lined by tall and low cuboidal cells. The tall cells are ciliated while the low cuboidal cells have absorptive properties. The volume coming from your seminiferous tubules are decreased here in the efferent ducts, thus providing a force that will promote movement of fluid from the seminiferous tubules into the efferent ducts. The efferent ducts will now drain into your epididymis. The epididymis consists of a head, a body, and a tail. And inside the epididymis, we have a very distinct pseudostratified columnar epithelium with stereocilia. The epididymis will serve as a temporary storage of your sperm cells until it matures. Surrounding your epididymis, you have your smooth muscle cells. And these smooth muscle cells, during ejaculation, will propel the sperm cells from the epididymis into the vas deferens. From the epididymis, you have the vas deferens. And the vas deferens courses from the testes into the abdomen, going behind the bladder. It consists of several layers of muscles and is lined by your pseudostratified columnar epithelium. The seminal vesicle joins your vas deferens to become your ejaculatory duct. The seminal vesicle is a very glandular organ with very prominent glandular folds. It will produce your fructose, your prostaglandin, and fibrinogen, forming 70% of your semen. The ejaculatory ducts and the prostatic urethra are in the substance of your prostate gland. The prostate gland will produce 20% of your seminal fluid, and that the representation here shows the tubuloacinar architecture and a very prominent fibrous stroma. In the old population, there is the prominence of your corpora amylacea. Prostatic examination is very important, and this can be done through your rectal examination. Prostatic enlargement in the older population may signify benign prostatic hyperplasia or prostatic cancer. This may result to obstruction of your urinary tract. At the base of the penis, you have your bulbourethral glands or your Cowper's glands. They are mucus-producing glands and they produce your pre-ejaculatory fluid along with that of your paraurethral glands. They prepare the urethra for the passage of your seminal fluid. This is a diagrammatic cut section of the penis. You have your corpus cavernosum and your corpus spongiosum. In the corpus spongiosum, you have your penile urethra. During ejaculation, the ejaculate or the semen will pass through your penile urethra. Erection of the penis is afforded by the presence of your cavernous artery and your venous plexus. Dilatation of your venous plexus will result to penile erection. During coitus and ejaculation, the semen will be deposited in the vaginal tract, and the semen and the sperm cells will now move from the vaginal tract into the fallopian tube. Capacitation occurs in the fallopian tube, and the fertilization occurs when there's enough number of sperm cells that's able to penetrate the zona pellucida, and a single sperm cell is able to fertilize the ovum.